Lineups at vaccine clinics across the U.S. remain steady, as frontline medical staff had to make a last-minute change, swapping out the Johnson & Johnson vaccine after federal health authorities hit the pause button.
You want to make sure that safety is the important issue here.
The U.S. has administered 6.8 million doses of Johnson & Johnson. Out of that, 6 women between the ages of 18 and 48 developed a rare but severe blood clot, all within 2 weeks of getting the shot. 1 woman died. A second is in critical condition.
This is a really rare event. If you look at what we know so far, there have been 6 out of the 6.85 million doses, which is less than 1 in a million.
Scientists will now study the 6 cases and determine a course of action. The White House says the setback will not knock it off its vaccination targets.
So there's enough vaccine that is basically 100% unquestionable for every single solitary American.
Canada has approved the 1-dose J&J vaccine, with its first shots expected to arrive later this month.
Obviously, we're following closely developments in the United States, and we can assure everyone that Health Canada will, every step of the way, put the health of Canadians first and foremost.
The J&J pause has some Americans worried it will fuel vaccine hesitancy in what so far has been a fairly consistent rollout.
I have friends who said that they would only get the Pfizer vaccine, like no other vaccine. So if they weren't given a choice to get the Pfizer vaccine, they wouldn't get a vaccine. So I am definitely worried.
Public health leaders are aware of those fears and hit the airwaves with the same message that any risk here is extremely low.
When you think about a 1 in a million event, that's, you cross the street every day, you have a much higher chance of getting run over by a car.
So, Katie, how long could this pause last?
The Centers for Disease Control says it could be a few days, but it's all going to depend on what they find out. Even though the Biden administration says this is not going to have an impact on their vaccination targets, Canada will be watching this very closely. The U.S. says it doesn't want to loan more of its vaccine until every single person here in the United States gets a vaccine that wants one. And the sooner the United States takes care of itself, the sooner it might be willing to share with its neighbor in need. Adrienne.
All right, Katie, we'll be watching. Thank you.
Thanks.
Now, all this comes after weeks of concern about blood clotting issues with the AstraZeneca vaccine overseas. Today, Canada recorded its first case. Health Canada says a woman in Quebec experienced rare blood clots after receiving the AstraZeneca shot. Her name and age have not been released, but health officials say she did receive treatment and is doing well at home. So far, more than 700,000 AstraZeneca doses have been given out across Canada with no other clotting issues reported.